it's in every cell as a complex, adenosine monophosphate, diphosphate, triphosphate. It's involved in so many enzyme reactions in the form of a cyclic AMP. You need not know all these biochemical substances. It will be little too much, maybe. I'm just mentioning it because, adenosine is such a powerful molecule, and it can give you the protective effect by increasing the blood supply. And this adenosine plays a major role in the capillaries. And when the blood supply is adequate, that means your organ function is normal. And since I said that there is no drug for increasing the blood supply, what the cardiologists normally will do is, we ask you to walk for about 45 minutes. The benefit of walking is not only to reduce the weight, not only to reduce your blood sugar, not only to reduce your tummy, but it is much more than that. It's much more scientific than that. That means the basic fact is, it increases the blood supply from head to foot. And we measure the cardiac output, the output of the heart in 1 minute as cardiac output, the minute output. It's around 4 liters. When you are sitting like this, your cardiac output may be 4 liters. And after a heavy meal, what happens? Much of the blood is diverted to your stomach and intestine. That is why, when the perfusion is low to your brain, you feel sleepy. So, the cardiac output, 1/3 of the cardiac output is delivered to the liver, 1/3 to the kidney, 1/3 to the brain, only very less to the heart. 60 ml per beat or 40 ml per beat, very less. So, the adenosine is such a wonderful, powerful molecule which is going to help us in protecting the blood flow. So, my message is that, you must walk. When you walk at least 45 minutes, that is 3 to 4 kilometers a day, you are protecting your body, you are protecting your heart, not only your heart, your entire body. So, when you want to protect your health, please walk. Walk for about 45 minutes. That's good. The other effect is, to keep up the microcirculation and to protect them, we give 2 kinds of drugs, clopidogrel and aspirin, so that the blockages, that's the clotting does not happen. And it is said that 1 aspirin a day keeps a heart attack away, because aspirin has got that effect of antiplatelet effect. And platelets are involved in the primarily in the clotting process initially. So that clotting process has to be averted so that you don't get a heart attack or any other blood vessel. And now, since adenosine and both these drugs, clopidogrel and aspirin, are very weak antiplatelet drugs. Very weak antiplatelet drugs. Still, we use it for whatever benefit it is going to give. And the Ganoderma has got 2 components. One is adenosine, other is guanosine. Both are powerful antiplatelet drugs. So by taking Ganoderma, since adenosine and guanosine is there, you are able to prevent the blood clotting, meaning that you can improve the micro and the macro circulation to all the organs, not only to the heart, to all the organs. The next powerful effect is on the pain and inflammation, pain and swelling. Ganoderma has got the effect because of the powerful effect of the polysaccharides. One of the commonest condition what we get in the old age is arthritis, because we have 240 plus joints. It is certain that all of us will have some form of arthritis as we age. It can affect your knee or ankle or neck or whatever. And what is the answer for that? In allopathy, we give painkillers. What is the other name for all these painkillers? They are all deadly poisons. So please don't take painkillers. They are very dangerous. And now we have the Ganoderma, which is a natural painkiller with safety, absolute safety. And you also know that recently two of the drugs are banned. One is nimesulide, other is rofecoxib. I think in India we have not banned. So you still continue to get these painkillers in the pharmacy. People take it and people get into complication, and maybe because of that, the population control can be there. So in many countries, all these painkillers are banned, especially these two drugs. And if one of the companies, the very big company, Merck, Merck, it's a German-based company, and they were, I don't know whether we will do it, but they have done it. Because that company was making so much of profit, billions of money on this one drug alone, but yet they decided to close. But we are not even comfortable, banning those drugs. So you should understand how serious it is. And we have a natural painkiller now, Ganoderma, which is able to help us in all these painful disorders, including cancer pain. It can control. But only thing is, it takes time. It takes about 6 weeks or 12 weeks to have that pain-killing effect. But I'm sure that most of us are not willing to wait till such time. And we want our doctors to give painkillers by injection. Immediate relief. Very powerful and dangerous poison by needle. Of course, if the pain is so severe, you have to take it. But please see that you are avoiding all such painkillers. Never take any painkiller without the medical advice. Never. Don't go to a pharmacy and say that you need all these drugs. Give me one nice or Nimulid or all these painkillers. They are very dangerous, and so many pain-killing drugs are under surveillance. They have not approved certain painkillers in US. FDA has not cleared certain drugs. As a trial basis, they have allowed 2 years or 3 years of their use. All this coxib, the rofecoxib, that's banned, then validacoxib, then so many drugs. So don't use that. You have an excellent natural painkiller. And this anti-inflammatory action of Ganoderma has been found to be effective in controlling two of the very bad, very serious brain disorders. One is Alzheimer's, other is Parkinsonism. They are very debilitating chronic diseases. It makes you, very incapacitated. You can't move around, you can't walk, you can't, your mental faculties also affected, especially with Alzheimer's. And in the University of Texas, they have done a study, and they have found that Ganoderma can help in these patients. I have a patient with Parkinsonism who has improved with Ganoderma. Of course, she is on other drugs also, but she has improved. Today morning, she is the bank manager's wife. He called me today morning, and doctor, where are you? Can I come and take RGGL from you? So I said, I'm in Thrissur. I'll come only on Wednesday night. I'll give it to you on Thursday. So I told him, you become a member and you buy the product. He was not willing. I don't know why. So he's my very close friend and very sincere patient, and the Ganoderma is able to help them. And especially in the brain, it does a lot of things, a lot of good things. And we have a neurologist in Chennai who is my student, Arjun Das, Deepak Arjun Das. He prescribes RGGL left and right to all his neurological patients, left and right. He gives